Another common reason I see for veterans getting denied by the VA that their injury was service-connected is a gap in treatment of that injury after they left the service. If you have a long gap between the injury and when you saw a doctor for it, watch this video to see how I believe that injury is still service-connected. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Let's say you hurt your lower back during your time in the military. Maybe you saw a doctor for it then, or maybe you didn't. But you managed the pain and worked through everything you had to do while in the service. Then you left the military and you didn't have issues with your back right away. Or maybe you did, but for insurance and other reasons, you didn't see a doctor. Finally, your low back pain got worse and worse until you saw your primary care doctor or maybe a spine specialist. Should that gap, whether it's a few months or many years, mean that the injury to your lower back isn't connected to your military service? I believe that even with a gap in treatment following your military service, the absence of a complaint or treatment is not enough to negate the existence of an ongoing medical condition and diagnosis. People don't, and often should not, seek medical treatment for every ache and pain. In addition, many medical providers just don't maintain records indefinitely, making it challenging for many veterans to obtain their records for treatment for long-standing injuries or conditions. Now, while some might argue that if there is no evidence of a persistent complaint after military discharge, then it should be considered that there's no service connection to the current diagnosis. And I disagree with that way of thinking. Some injuries or some types of pain can often lead to chronic pain that persists for months and even years after the initial event, especially if there was ligament, tendon, muscle, bone, or cartilage damage that never properly healed. I've talked about this in another video. Something like arthritis is something that the damage can really start a long time ago in military service. Maybe it's a traumatic event, maybe it's wear and tear over time, but then those symptoms sort of come and go. They're not awful right away. So you get out of the service and then you start with a job, you go do other things. It doesn't manifest right away. It may be years before that cartilage and bone keep breaking down to the point where it really starts to limit your day-to-day activities, starts to affect your job activities, starts to affect your life. So you see a doctor, seek treatment, and now you feel like, hey, I'm going to need a knee replacement or a hip replacement or whatever it is. And then the VA is potentially saying it's not service related because it's been 3 years or 5 years or however long since I left the military. And I disagree with that because, again, these problems can start during the service, but then develop over a period of time. And you don't necessarily go to the doctor for every single ache and pain. I really believe there are ways to argue that it still should be service connected. Now, if you have ideas for topics for future videos on this channel, whether it's risk factors, injuries, particulars of nexus letters and DBQs, or anything else, leave those in the comments below. Make sure to subscribe to my channel and click the bell to be notified when I release a new video. If you're interested in a nexus letter for your injury or condition, click the link in the description below to learn more about working with me and working with my team. We do everything we can to make the process as simple and quick as possible for you, and I strive to write a nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you much more.